The whole process of vision is just something that's just absolutely staggeringly amazing. The retina is 11 layers thick. You have a photoreceptor layer of rods and cones. You have 130 million of those in each eye. 130 million. How do you cause that to turn into an electrical impulse to go into the brain? Because that's where vision takes place, is in the brain.
Vision therapy, if you think about it as physical therapy for the visual system, you'll have it. So it's really about brain work. We actually rewire the hard drive. So if there's a glitch in a processor involved in reading, it makes sense that remediating that would be one of the first steps you would look at.
Optometry is more than just glasses and seeing 20/20, but then, hey, we can actually do something for kids.
It was hard to read because all the letters were bouncing around, and like when my friends came up and asked me what my reading level was, I would never tell them because I just felt embarrassed because of how low it was. When I first came in, I was nervous because I didn't know what you guys were gonna do to me. But then once I started doing it, I got more comfortable because I knew you guys were gonna help me. I don't feel like I'm behind as much with the other kids. I can read bigger books now because it's not just jumping around. I actually see where the ball is. I just tell everybody, I'm like, hey, look at this. But they know I'm up and everyone's proud of me, and so.
Before the vision therapy, I had a really hard time focusing on reading. It was just kind of frustrating reading for long periods. A lot of times just couldn't pay attention to the book because I kept on losing my place quite a bit, and now I can read for like an hour at times.
My left eye wasn't really catching up with my right eye. My right eye was better than my left.
Once we got into first grade, the teacher was real concerned about how far behind he was on his reading. He was reading about 18 words per minute, and he should have been at that point at around 30 or 40.
Because of the therapy that I had helped me a lot, because now I can do things that I never could before.
It was just amazing to help him track, and it, like you said, made him more focused. He wasn't getting in trouble in class. He'd get frustrated and just get up and go do something else because he couldn't stay focused and read what they were reading. So a whole new second half of first grade. It was like a whole new Logan in class.
I was always skipping lines and flipping letters, and it got confusing and hard, but I'm glad vision therapy has helped me a lot.
So if we are having problems with focusing, if we're having problems with the alignment, if we're having some tracking issues, then the information that we're getting into the brain is going to be garbled and going to be skewed. There are 3 essential visual subskills in vision that are critically important to how we see our world. The first is the area of focusing or accommodation, your ability to see clearly. The second is in the area of binocular fusion. If eyes are having a hard time maintaining alignment, that is tremendously disruptive and creates a lot of noise. The third is the area of ocular motor control or tracking, the biggest problem that we see where patients will skip words, skip lines, lose their place. When these 3 skills are functioning properly and smoothly, this affords us higher level processing of visual information, what we refer to as visual perception. I see so many of these kids that come in now have these issues of skipping lines, losing their place, having to use their finger, and it really interferes with their ability to just get lost in what they read.
We run a clinic, but we run it for people.
We actually tailor each of our plans to each patient, so it's not just a cookie cutter process for everybody.
I think we care about the welfare of the patient, and I think they take a heart and interest in who they are, treating them like we'd want to be treated. So I think we do a good job with that.
We really pride ourselves on using some of the newest, latest, state-of-the-art digital lens designs and manufacturers.
We blow people away all the time with the technology because we tend to be on the cutting edge of some of the computerized equipment that we have. We think that we give them the best care they can get. I guess if you were to ask me the one thing that I feel good about, it would be the fact that I have people that have been with me all those years have the confidence in me.